to the FDA for the invitation to discuss our research on estrogen action in the brain. These are my disclosures, and I want to particularly point out the support from the NIH, National Institute on Aging, who's supported this research for quite a long time that I will be presenting here. 2/3 of all women, Americans and worldwide, of Americans with Alzheimer's disease, 2/3 of them are women. And it was really one woman with Alzheimer's disease who transformed my scientific career. She could not remember me for 30 seconds, and I've remembered her for over 30 years. And why does that occur? It turns out that our research has shown that it's not because women live longer than men by 4.5 years. It's because the disease can start earlier in women during the menopausal transition, when the brain undergoes a substantial loss in the ability to utilize glucose as its primary fuel. This work, our basic science research, was supported by human FDG PET and MRI imaging conducted with our collaborator, Lisa Mosconi at Weill Cornell, which shows that the female brain during the menopausal transition undergoes a decline in glucose metabolism and a coincident rise in the deposition of beta amyloid in the brain during this same time frame. There is a small but not specific loss of gray matter, not beyond the normal aging. What there is, however, is a decline in white matter, those connections in the brain that enable communication across all neural circuits in the brain, giving rise to some of those symptoms that women can experience, the whatchamacallit syndrome, the inability, to recall names, recall information. We have also focused on understanding the hot flash. And the hot flash is actually induced by the generation of brain heat. And that heat is generated by the change of mitochondria from highly efficient to inefficient. And I think many of you will recognize the meme that is there of a woman who is experiencing a hot flash at a football game, and you can see that the heat is emanating from her head, and right below is the brain. What we have also conducted is medical informatic analyses to really address the question, is hormone therapy, menopausal hormone therapy, associated with reduced risk of developing age-associated neurodegenerative diseases? And here what you see is hormone therapy is associated with a reduced risk of Alzheimer's disease, Parkinson's disease, all-cause dementia, multiple sclerosis, and ALS. Now, there's, as you've heard, much controversy over the impact of hormone therapy. And what our research has shown is that the brain is indeed changing. That decline in glucose metabolism activates a starvation response that leads to utilization of auxiliary fuels. And that auxiliary fuel is provided by the white matter. The brain will utilize its own white matter, catabolize its white matter, lipids, to generate ketone bodies. And what we see is that depending upon when hormone therapy is introduced, whether, as been spoken about previously, when introduced at the time of menopause and for menopausal symptoms, there is a significant reduction in risk of developing Alzheimer's disease. Whereas when the brain has undergone this decline in glucose metabolism, a rise in inflammation in the brain, there's an increased risk of developing Alzheimer's disease. And the gap that we still have in the menopausal hormone field is really applying precision medicine approaches to generate precision hormone therapy for all women where appropriate. Thank you.